So as I was saying this morning, the topics, right, what we're looking at is, this is from the Joint Commission Center for Transforming Healthcare. Approximately 11,000 fatal falls occur in the hospital annually. 11,000 fatal falls in hospitals annually. The cost of those falls and $56 are the estimated average cost of a fall with injury, right? That's quite a bit. Well, why are we talking about that? Why are we starting off in the hospital? Well, let me tell you. Today what we're going to be talking about is osteoarthritis or arthritis, and then also total joint replacements, or what's known as TJA, or total joint arthroplasty. And we're talking hip replacements, knee replacements. About 1 in 4 U.S. adults, it's about 23%, well, if we round it up, it's about 24%, or about 58.5 million people have doctor-diagnosed arthritis, almost a third. Arthritis is more common in women, with about 24%, compared to men. About 18% of men have arthritis. More common among adults with fair to poor health, 40%. So if 40% of those with fair to poor health, as compared with those who have excellent or very good health, you want to know the difference of exercise? 40% in fair or poor health. Anybody want to guess what the percentage is for those that are considered in good or excellent health?
10.
18. Very close. We had an answer of 10. It was very close. Compared with adults that are insufficiently active or inactive, it's somewhere around 23, 24%. So arthritis becomes prevalent with age, and it can have substantial impacts on individuals and their function, right? And that's what's important to us, is how we move. Legs and our strength in our legs are the basis or the foundation of all movement. So what we're looking at is about 43%, 23 million of the 58 million adults with doctor-diagnosed arthritis have limitations. So of those that have arthritis, you're looking at about 43% of those that have limitations in their activities, in their daily activities. And so what we have seen as time has passed, in 2004, the prevalence of arthritis in adults was about 46 million people. 2008, 50. In 2014, 54. 2020, we had 63 million people, as compared in 2004, 46 million people. Well, what happened? Well, we started getting into that trend where our baby boomer generation is starting to get older. They're starting to retire. We have 10,000 Americans, remember, turning 65 every day. That trend is going to continue through 2030. This is on this sheet right here. Again, all sources and references are available at mybalanceuniversity.com. At the bottom of the page under references and sources, you guys can check this out. So how does this impact arthroplasty, right? How does this impact knee replacements, joint replacements? People get to a point where they can't walk, they can't move. That's not a good thing, right? We've discussed that many times, why we need to move it, all the way down to going to the restroom, right? And how it impacts our hearts. Well, the definitions of falls in these studies, you guys might find this a bit humorous, but they actually defined what a fall is. We all think we know what a fall is. Well, the falls, it varies, and this was in 6 studies where this definition was used. And it was an unexpected event in which the participant comes to rest on the ground, floor, or lower level. Not as a result of a major intrinsic event, right? Such as fainting or a stroke or a seizure or an overwhelming external hazard, right? That's what they tell you. You know, if you jump from a building, it's not the fall that kills you, it's the sudden stop at the end. So, patients are recovering from total joint arthroplasty are at risk for falls, which can lead to restriction of activity and negatively impact recovery. So if it's negatively impacting your recovery, what's that taking away? That's taking away our socialization, it's taking away our exercise. A lot of folks exercise in groups, they like the group fitness, right? And we know how socialization is to the BDNF to keep the brain malleable, right? To build those structures in that brain to help stave off Parkinson's and Alzheimer's and dementia, to keep our memories sharp, right? We need that socialization. Objective of these studies was to review and critically review evidence in the number of falls, the fears that were associated with the falls for patients who are waiting for surgery or recovering from surgery, all from total joint arthroplasty or from joint replacements. An increased risk of falls in patients was reported for both patients waiting and for patients recovering. Well, that makes sense, right? If you're waiting for a joint replacement, obviously there's something wrong. But here's the thing. In recovery, what happens after you have surgery? You go straight into physical therapy. Most of the time, a lot of folks do therapy in facilities. Well, we just talked about that statistic, falls and fatal falls in hospitals. 11,000 fatal falls occur in the hospitals annually. So what we want to try to do is get in and out as fast as possible, right? So that therapy is extremely important. Now, what are some of the things that is caused by arthritis? Well, we have pain, decreased function, right? And here are some of the main reasons why the people with osteoarthritis, they fall, is because of the pain. People change the way they walk, they change the way they move, and that goes for any injury. Any injury, we always will subconsciously dodge whatever movement that is that's going to make us hurt, right? So decreased function, that's a decrease in movement and exercise. We know how dangerous that is. So one other thing I wanted to get to, in a 2015 Arthritis Care and Research study, people with pain in one lower joint, knee or hip, were 53% more likely to fall. It's a pretty powerful statistic there. Those with two affected joints were at a 74% higher chance. So here's the thing. What can we do to prevent arthritis, right? Well, there's not a whole lot, but we do know it depends on how you've used your body in your life. It depends on your job, right? There are a lot of external factors. We do know exercise can help decrease the symptoms and the pain of arthritis. And of course, if it's bad enough, definitely get a joint replacement. Talk to your doctor. You want to avoid all those things, the pain, the stiffness in the joints, the pain medications. Did you know things like NSAIDs can help increase your risk for, or can increase your risk for a fall? NSAIDs are things like ibuprofen, naproxen, like Aleve, or aspirin. So that was surprising to me. And also consider vitamin D, right? Vitamin D, several years ago, was coming out in research showing us that it was helping preventing falls. They were seeing this in patients with high serum levels of vitamin D. Also, vitamin D helps fight the inflammation that we see from COVID. I actually came across a research study from, I think it was France, way back when, March, April, maybe April or May of 2020. Posted a video on YouTube. They took it down. And then, of course, now it's back up. You know, I had to petition. But there was a lot of things that everyone was unsure of, right? We'd never seen this before, and it was unsure what was going on. But vitamin D, certainly a lot of research to back up. Well, how much vitamin D should you take? Always talk to your physician, right? I'm not a physician, so don't take my word on it. The recommendations that I'm quoting here are from the Arthritis Organization, and what they're saying is 7 of vitamin D is what their research has shown what they've seen in patients who have fallen less in their research, okay? So guys, you know how I like to do these. I like to go through here. I don't want to take a whole lot of time. I've already taken quite a bit. So what we're going to do, there's a nice study in here from Korea where they found arthritis that you can have for a long time, like their entire life. The arthritis groups have a higher prevalence of falls. Just continue, study after study just goes through here and talks about arthritis and falls. Let me make sure I don't leave anything out. The annual fall rate for patients with hip osteoarthritis was about 50%. Fall rates for patients with knee osteoarthritis and severe osteoarthritis were up 50% and 63% respectively. So just some different things you guys to check. How many of you have arthritis or have been diagnosed with arthritis? I don't want to put anybody on the spot, but I can tell you